Hi, in this presentation I'm going to talk about immediate care bags and the equipment that I carry myself for attending immediate care incidents. There's no ideal bag on the market and everybody has different requirements. Some people prefer to have a separate bag for separate sections, some people like to carry their oxygen with them, other people prefer it in a separate bag. I personally use this bag, which is an old ambulance service bag, and I find it works really well for my needs. The bag has a front flap on it, which when opened allows immediate access to a lot of pieces of equipment that I use regularly, and in fact quite often I don't need to do any more than open this flap up in order to manage a patient in an incident. Within the top section of the flap here you can see a variety of nasal and oral airways along with some lubricant. I've got tough cut scissors, I've got a variety of syringes, needles and cannulas, a tourniquet, a tongue depressor for assessing gag reflex, and also here a size 5 LMA which I can use in the situation where it's apparent straight away that it's going to be appropriate, and I guess the commonest scenario would be a cardiac arrest. With two big pockets at the front of the bag here in which I've got my BM meter, I've got a sharps bin, and I've also got plenty of protective gloves, and these are really useful at the scene of incidents, not only for your own protection but also to give to other people who may be willing then to hold on to a neck for immobilisation, for example. In this section here I've got a handheld suction device, and inside I've got a yanker and a variety of suction catheters that I can attach to it. And I've also got a single-use resuscitation bag and mask set for adult use. Further down in there I've got some spare oxygen masks and also a nebulizer set that I can use if need be. So this front section of my bag really has most of the things that I'm likely to need, particularly early on in an incident, but quite often, as I say, I don't need to open up much more than this. In the next section of the bag here I have 3 adult stiff neck select cervical collars. These offer 4 of the 6 standard adult sizes in one collar, and although they're not perfect they do offer a very good compromise for immediate care practitioners, and I find them very useful. The next section of the bag contains 4 different compartments. In this bag here I have my immediate care drugs, and I'll be covering those in a separate presentation. This compartment here contains my surgical airway kit with a ready-made up cannula, tubing in order to insert a cannula for an immediate jet insufflation kit. I've also got a mini-track, skin prep and local anaesthetic in that bag. This bag here contains my chest management set with a chest drain kit, an Asherman chest seal, more skin prep, and also a quick clot first response clotting sponge for those situations where there's massive external hemorrhage. In this little bag here I've got a few odds and ends, including blankets, bandages, crepes and that sort of thing, which I find useful from time to time. If I open it up, the final section of the bag is largely given over to advanced airway management. I have a variety of LMAs, both sizes and shapes, along with the appropriate syringes for attachment, and also lubrication jelly, tapes, gauze swabs. I've got a flexible connector and a posi tube, which I find very useful for confirming placement of tubing. I do carry a variety of ET tubes. I still attempt intubation when I feel it's appropriate, although it's important to not spend too many times trying to do this if it's not working well. I've got 2 laryngoscopes, so I have a backup system, and obviously it's important to check the batteries and the bulbs in these regularly. And then I've got a variety of connectors, mainly to attach ET tubes and LMAs to the patient. Down in this section here I've got a few more cannulas of different sizes. I've got one 500ml bag of normal saline and a giving set. I don't carry any more fluid than that, both because it can go out of date, it can get cold, but it's also heavy, and frontline ambulances carry fluid and I prefer to use theirs whenever possible. I've got a variety of syringes and needles and water for injection and Hepsal in this bag here, and finally an interosseous needle and a couple of easy caps for assessing ventilation if we do intubate somebody or put an LMA in. And that really completes my bag. It's fairly straightforward, it's fairly simple, and the important thing with the bag is that you have the things you need to hand very easily, particularly things you use often, but that you do know your bag so that when you come to an incident you don't have exploding bag syndrome where everything goes flying trying to find the one thing that you need. These bags are quite useful. They have the Velcro so you can take off the particular section that you need and put it back without destroying the whole bag. I'll be covering drugs and protective equipment in a separate presentation.